The Coalition Association was formed as a way to unite coalitions all across the state. We have coalitions in communities all over Utah, but for the most part they were working individually on issues in their community, and some of the prevention issues that we're tackling are much bigger than that. They're statewide, federal level prevention issues, and so the Coalition Association was a way to kind of unite all of those coalitions and give them a venue through which they can communicate, as well as provide them training.
Coalition work is the most effective way for us to help people at the local level, because local coalitions know the strengths and the risks that their community has. And so when people get together to help kids, they know the things that the kids need in their local area, and it's a comprehensive effort, a team effort.
We have a great system in the state of Utah with under the State Division of Substance Abuse divided up into 13 planning districts. In each one of those planning districts we have one or more school districts. We also have health departments, we have law enforcement, and it's critical in prevention that we engage all these various sectors in the prevention work.
Together they assess their community to find out exactly what the issues are and why they're issues. They assess themselves to find out what their capacity is to do something about that, and then together they plan and they implement effective strategies or programs, and they evaluate whether or not they're being effective and how they need to change them. All of a sudden, when you do that, prevention becomes possible.
Our coalition started November 2010 as a grassroots effort. We had about 6 community members that were concerned about the youth problem behaviors that they were seeing in our community. So we decided to do something about it.
And so as they got to looking into the Communities That Care program, they decided that it'd be a perfect fit inside the police department. When you have a city that's as small as Draper City, it just became a natural fit to have it inside the police department as opposed to anywhere else in the city or in the state for that matter. The basis behind a police department having success inside the community is having involvement. It goes back to the foundation of community policing. If the police department is able to reach out to its community members and collectively they can identify and then solve a problem, then you get buy-in from the community, you get enthusiasm in the community.
In our community we have identified several risk factors like low commitment to school, depression, underage drinking, the e-cigarettes.
Assessment is a very important piece of the coalition efforts. The assessment allows you to determine what your community needs are, because they're very unique and different from other communities, even within your own county. The SHARP survey is one of the tools that we use that is promoted and supported by the school district. It allows us to identify what risk and protective factors are and what problems that we need to address. In doing the assessment with the SHARP survey, we identified that underage drinking was a problem outcome behavior in our community. We looked to some of the local evidence-based resources within the state. The state has a campaign called Parents Empowered, and we felt like that would be a great fit for our community. We applied for a $10,000 mini grant, and we felt that it would be a great opportunity for us to bring the biking community together and create an opportunity for us to talk to parents. We ended up providing a parent tune-up at this event and spoke to over 600 parents at this event about the prevention tools that they can use to prevent underage drinking.
One of the great things about working as a coalition is that we get different perspectives from all different angles, and so we're looking at this problem from different directions, and that's what's so useful about the coalition, is because I don't necessarily see different problems as much as people in the community or the police department do, because here at school we don't have a problem with underage drinking, but the data reports that we do, so the kids are reporting it in the school and then they're using it outside the school. So it takes all different angles to be able to say, hey, this is what the problem is, this is how we can address it, and this is how we can change the future.
We can implement programs all day long that are working for other communities, but if we don't determine what our community needs are, specifically, then we won't be able to know what programs are going to be effective.
Capacity building is so important because we in communities actually have to have the ability to make the changes that we've found in our assessments that are necessary. It's like going down to the hardware store and buying some nails and screws, a couple of 2x4s and plywood, and going home and expecting to build a shed. If you don't have the ability and the plans to do that, you're not going to be able to build a successful shed. And it's the same thing in our communities. I firmly believe that once we provide communities with the tools and the materials, then they are best suited to solve the problems that are going on in their communities.
Recruiting members for a coalition tends to be challenging for a lot of groups, but once you've done an assessment, you'll see some of the gaps perhaps in what needs to be done, maybe the issues that need to be addressed. And once you identify whether it's in a community or a substance use or mental health issue, knowing which agencies that exist in your community doing a resource assessment help you identify maybe who to reach out to.
Some key pieces to coalition structure are having a chair that's passionate and that's driven to be able to organize the members of the coalition and to hold meetings that are productive and making sure that everybody's kept on task.
Another way that we can recruit and engage community members in different sectors is to have a community member agreement. Having something that's in place that shows what is in it for them so that the agency is not only willing to commit time and energy and some other resources to the coalition, but also what can they get in return? What kind of things will they be able to draw from the coalition? Is it data? Is it support from other agencies and community members? Is it something that they can build upon or that they can even offer to the coalition, such as services or location and space?
Another thing that can really help coalitions is by creating bylaws or a formalized agreement on what our roles and responsibilities are going to be within our coalitions. As we're trying to implement strategies and coming up with ideas, some of us are going to have different ways of looking at things and different ways of viewing things. And so having some bylaws in place that help guide us in our decision-making process is really, really helpful for us to be able to get to something that's actually going to help our communities.
So here in Panguitch, our coalition has been focused on prescription drug prevention, suicide prevention, increasing family attachment.
We help not only the youth in the community understand more about drugs and alcohol and various things, but also the parents.
We feel like the basis for any education or anything that goes on good in our community is the family. And so when you can keep the family together, when you can keep the education going on inside the family, there's a greater chance for these kids to be successful.
So we use the SPF process to plan and implement our activities. So you assess what you have. So what are your resources? Assess the venue that you want to hold an event at. And then you go into capacity building as far as like, who do we need to get involved with this? And then we go into the planning of the activities.
I think it's important that we all come together because we see things from a different standpoint.
Everybody has different ideas because each member of the coalition is taking it from their point of view and what they see out in the community.
We share information, we share problems, and a lot of times it's kind of like a think tank. So we come up with things that we can do to better achieve our goals.
It's really important to know in the planning process of the who, the what, the where, the when, the why.
The recent trainings we've received through CADCA have really helped us in our planning strategies, develop logic models. So instead of kind of, just I guess a shotgun approach where we just hopefully, do a bunch of activities and hope they're making a difference. We, base our activities and solutions off of questionnaires and data that we've got from the communities.
If you don't plan for what's going to happen, you won't have a very successful activity and your outcome won't be what you want it to be.
We are one of the driving forces for getting information and activities and resources out to families and communities to have a group of people that volunteer their time and their efforts and their resources to help a community is like the true sense of a community.
Back in 2009 when we did our community readiness surveys, the only prevention that was noticed was the prevention that was done by the prevention specialist and a little bit through the Sheriff's Department. And then in 2013 when we redid our community readiness survey, 75% of people that took the survey recognized our coalition as a prevention resource and actually listed specifically events and activities that our coalition had done. So we feel that our coalition is a great resource in the community. It's important for the community, and they are recognizing that we are the prevention for our community.
Our coalition started in July of 2011, so we've been almost 5 years. And so we started at the very beginning. We started with just manuals that they gave us, and then along the way we picked up a lot of trainings for communities that care, and we are now in full implementation. We've gone through the whole process. In Payson, the risk factors are low neighborhood attachment, depressive symptoms, and low commitment to school. Depressive symptoms is a new risk factor for us, and so we're concerned about that because of the amount of not only youth suicide but adult suicide that we've seen in not only our community but surrounding communities, so that's a big concern for us.
There is a high rate of suicide. There's a high rate of, I think Utah's number 4 with opiate and alcohol addictions and overdoses. The rate of problems within substance abuse within our community is really, really high. And if we don't address those kind of issues even early on, they'll just continue to snowball and be a huge burden on our society and our culture.
Right now we've been implementing Strengthening Families, and we feel that covers all of our risk factors pretty well. And so we try and involve as many families as we can in that.
The other part of the coalition that I love and appreciate is the Strengthening Families part of the program, where we get families that are in trouble, families that are struggling, families that need help and support, and they don't know where to find it. And by sending them to the Strengthening Family classes, they get the tools, they get the skills that they need to be better parents and to help raise their children.
We also do our Youth Mayor Recognition Awards, where we recognize youth for the good things that they are doing in our community.
The mayor's program to recognize youth in the schools, that's been a great program in our city council meetings and bringing people together to recognize those that are making a difference in our community. And I think looking at the surveys that have been taken since we started the program, I think some of the risk factors have gone down. And so it's a matter of putting your time and effort and focus on problems and see if you can solve them.
There's a great deal of time and effort involved in implementing these programs and making them successful. Putting it together takes a lot of time. It takes a lot of people, it takes a lot of resources. It takes a lot of support, not only from the community, but from the government organizations that we deal with, and from the health organizations and the family organizations that we deal with and coordinate with.
Before we implemented Strengthening Families, we pretty much went through all of the process of Communities That Care and came up with an action plan. And so Strengthening Families was part of our action plan. Our Movies in the Park was part of our action plan, and so was our Youth Mayor Recognition Awards. I think it's really important that you have an action plan in place. That kind of is your roadmap for your coalition on what you want to do and what you want to accomplish. And then I think we just have to be creative and involve as many other people in the community as we can, other businesses or corporations, and get them to help us with the things that we need. And so far we've been pretty successful in doing that.
The Washington County Youth Coalition is a group of volunteer teens, and our motto is to create a better, safer, healthier community, and we do that through drug prevention. We work in the school systems trying to educate our peers on the different problems that we have in our area and how to say no to drugs, even at the elementary level. We work with our local policymakers to try to create policies that back that same belief. We work on the statewide level with a statewide initiative. We've been working on trying to see if we can get further regulation with e-cigarettes to get them out of the hands of kids.
So something we've taken on the past 3 years is e-cigarettes, and that's what our problem in our community, because in 2011 to 2013 the rates doubled in our community, and in 2013 2015 they tripled. So that's a really big problem in our community. We're trying to get that problem solve.
Evaluation is a very key part of running a coalition. We want to know if what we are doing works, if what we are doing is affecting community change.
In evaluation, there's two things. There's a long-term and a short-term. And a lot of times the long-term deals with data. And you take data and it takes a long time to take into effect because you learn, but it's through our short-term goals that we're able to see the effect and how it changes.
We show people that we care about what we're doing. We meet together after every activity and we go over what was effective and how we can make it better. And also during the summer we go to leadership camp as a coalition.
We do our main evaluation at the end of every year. We take our presidency for the next year and we evaluate the whole year's work. Did this work? What could we do better? What other community partners can we engage? And do we want to do it again next year? Did we accomplish the goal?
Without effective evaluation, you're really just a group of people that might try to help, but really you're just taking shots in the dark.
I personally, as an advisor, try to make sure that I celebrate them by just even a small text. You did great today. Awesome work. You're making a difference. And I think that's really what feeds them.
It's something that I have come to know and to believe. That I know that saying no to drugs is true. That I know that they can influence my life in a bad way. And I know that I want to be able to tell others about that, not just say to myself, oh, I know it's bad, and just leave it at that. I want to be able to go and let others know how I feel through the community, to legislators, whoever it is, to let them know what we can do to become better.
I think the community is becoming more and more supportive. That's what it takes. It's important that the community be more aware of what's going on and the importance of these coalitions in helping their children to choose the right path.
And that's really what we're trying to do, is we're trying to create a future for these kids that they wouldn't necessarily have otherwise. And so that's what the goal is really to create a 24/7 structure for these kids so that we are all working together with the same intent.
Prevention is prevention, and the science has shown the more we're engaged in building and eliminating some of the risk factors in their lives and helping people with protective factors, the greater success we have.